Hi, my name is Benjamin, and I work as a scrub nurse in the operation theatres. And you're watching 5 Questions. What does an OT nurse do? Alright, it's a big question. We basically assist the surgeons in the operation, and usually that's what you see in the TV shows. We hand over the items and we predict what they need and the flow of the operation to see what suits, what instruments we need to take out and what suits the operation needs at that point of time. But that's just one part of our job. We also have circulating nurses which run the operation theatre for that specific theatre to make sure that, because as a scrub nurse, when you're scrubbed out wearing the gown and everything, you can't touch anything that isn't sterile. So you need someone to help you open up your instruments and your consumables, or maybe implants and things like that, and then they do all the checks with you before opening. And the overall theatre, and of course, usually there's more than just one theatre in a hospital, so maybe they have 10, 20 or something. The in-charge will actually be in charge of all the patients coming in, how many patients we can see in a day, how many, like example, in an hour, like let's say 5 to 8, I'll count the regular office hours, how many can we stagger, and how many surgeons are there, how many anaesthetists are available, and then trying to stagger all the manpower and fit everything in so that everything's running smoothly. Lastly, we also have things where we have to make sure that the instruments are available from the other vendors that we need for each individual operation. Let's say, because my specialty is in orthopedics, we have the spine theatres, trauma theatres, and we also have the arthroplasty theatres that they are running. So all these require different instruments and different sets and different implants for all the different companies. So we have to liaise with all the external vendors and all to get things ready for the next day as well. And if it's a very emergency case, then we need to get everything done now, or as they would say, everything needs to be here just now. What is a common misconception that people have about nurses? When people think about nurses, they think about ward nurses, the general nurses. There are a lot more than just ward nurses recently, and well, historically there's been OH care, the regular specialty wards, if you're gen wards and you're maybe cardiac, your respiratory. You also have nurses in radiology department. There are radiology nurses. And there are also, let's say, the external, the ones that work outside of the hospital. How's it called again? Community nurses. Yeah, so those are all the different fields that are slowly, quickly approaching and increasing in size, because lately we've been figuring out that instead of trying to treat people in the hospital, if you can prevent them from coming into the hospital in the first place, you lessen the workload, it's better for the patient in general. So back to what people think about what we do all the time and misconceptions is that we generally just give medications and clean people's butts. That's very far from the truth, and we have a massive amount of workload and things that we can do in just the hospital setting alone. We need to liaise with, let's say, your patient family members. We need to do a lot of documentation. That's one of the things that people can't see because it happens all in the background, and honestly it's a lot more than what it seems to be. And luckily now there's computers, so reading doctors' handwriting is a lot easier than it used to be. Then on top of that, we have to try and convince patients to stick to their physiotherapy sessions and educate them about how to take care of their wound, how to prep themselves before or after operations, and how to do the whole mobility exercises, trying to eat well and holistically look at someone from head to toe when you're looking at them to see if they are falling ill, they're getting better, are they following the therapy right, are they showing signs and symptoms of degradation, or are they actually on the road to recovery and on the road to getting out of the hospital as soon as possible. Having worked in a hospital setting in both Australia and Singapore, what's the main difference between the two? This is harder than it looked like, because usually there's a lot more cultural differences and the workplace differences. It's all really small and minute. It's not something that you can really say that, oh, like A workplace it does this differently than B workplace, because every workplace is slightly different. and or the SOPs regarding the rules, they're all slightly different as well. So that generally has some difference already. But in a country-wise, the people and how they react, how they talk to you are quite different. For example, in Australia, the indigenous people, if you are a male talking to a female indigenous person, you are not really expected to have eye contact because that is rude to other people. So you have to kind of gauge your expectations and how people will react to what you're gonna say that way also, and watch how you interact with other people. For colleagues wise and who you work with in general, I would say they're a lot louder and they're more assertive in what they want, and also generally more peppy and brighter in personality. But of course it varies from person to person. Whereas in Singapore, everyone's very efficient, they're trying to get things done, everyone's trying to do everything as fast as possible, as best as possible. Sometimes at the cost of the people working and their own physical and mental health. So that might be something we can change.
How about medically specifically?
Medically specifically, okay, there are not that much difference. So if you're talking about the medical practices and best practices between Singapore and Australia, there isn't that big of a difference because both Singapore and Australia work very closely together in our whole union in medical practices as well. So in that side of things, it's not that big of a difference in general. Yeah. What do you find most challenging about being a nurse? Well, the shifts being one, but I generally do quite like shifts as well, but night shifts for me are particularly tiring because I'm quite an early riser. I cannot stand staying past like all the way through the night and having to work your best in that situation as well, because just because you are tired doesn't mean you can afford to let yourself make a mistake. And that's the reality of being a nurse in general. People don't care about how you feel, people don't care if you work for 10 hours already, and people don't care whatever something bad has happened to you or whatever you've been doing just now. They want things to be done correctly and they want things to be done safely, but you as a person doesn't really matter. On the other hand, you have to treat someone you are treating more holistically and as a person and a human being in general. Sometimes I wish people would look at us that way as well. Share with us an interesting story of something that happened as an OT nurse. There's not many interesting things that has happened, but in general, because I like the OT environment, I get to see the insides of people. And you know what's the saying? It's what the inside that counts. Even if you're beautiful on the inside, doesn't mean your body is beautiful on the inside as well. But either way, it's quite interesting for me to see where the whole medical technology is going in the future as well, because we have new implants always readily coming out. We are able to do more like amazing surgeries that we've never done before. We can replace whole legs, we can extend, reduce your whole limbs, we can reattach fingers, nerves. Even if you get a whole hand chopped off, you can stitch it all back together, and post-operatively, some of the patients have actually been able to use arguably not all of it, but most of their limbs back, which is better than losing the whole hand. So I think that's very interesting, that part. Yeah. Alright, this has been 5 questions. And if you like what you see, like, share and subscribe to this video down below. And see you again next time. Alright, this has been 5 questions. If you like what you see, like, share and subscribe down below, and peace out.